Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel, and today we have another special guest. This is the treat, folks. Data scientist slash hobby farmer slash stand-up comedian. And Saulnier, she actually is the CEO of Hex IQ, a fantastic company that actually helps physicians or med tech companies find out where their products are reimbursed, a level of detail that you cannot find anywhere else. And this company is doing amazing things. If you have a product that requires reimbursement codes or product that has diagnostic codes, this is an episode you can't miss. You literally can't miss it. And I don't even care if you're a physician, sales rep, or a leader within a med tech organization. If whatever you do deals with codes, you better listen to this episode. It can literally change the game for you. And in addition to that, you get to hear how this person started this amazing company, finds the time to have a whole full-blown family and do stand-up comedy that, wait for it, we will include the links in the episode. As always, we're doing our best to bring you guests that are doing things differently in the medical sales space. So I really do hope you enjoy this interview.
So it's beautiful here. I'm in southern Maine, so up in the New England area.
Wow, okay.
Yeah, doing the last summer weekend, so
Nice.
exciting.
Nice.
And I'm super excited about this new data product that we have that is game-changing for a lot of our customers. So I'm excited to chat with you about it today.
Tell me more. Before we get into it, what's this product?
Yeah, so there was a law that was passed in 2020 that went into effect in 2022, and it requires that all commercial insurance companies publish every single rate that they've negotiated with every provider. So every doctor, practice, hospital system. And so it makes it possible to see what every provider gets reimbursed for any service or product that they offer. And so it makes it possible to prove out ROI for anyone who sells into healthcare in a way that has never been possible before. So it's totally game changing. And
that's cool. Okay. Let's start from the top. What is Hex? You're Chief Executive Officer of Hex IQ.
I am.
What is Hex IQ? Break it down for us.
All right. So we are a data science company, and we're focused on disrupting healthcare by showing all of the negotiated rates that insurance companies have with every single medical professional in the United States. We're a team of 17 people based half in the northeastern US and Canada and half in Croatia.
Wow.
And we have been together for about 10 years now, solving puzzles. And when this data set dropped, we were so excited at the potential. And so we've been having a lot of fun parsing through it and working with customers and finding use cases. And
So who's your target customer?
So we help medical sales professionals shorten their sales cycles and find the right targets to go after to prove out ROI for the products and services that they offer.
Wow. Okay. So is this company or individual sales reps can just say, hey, I want to sign up to do this?
It runs the gamut. So we have a mix of customers who are individual contributors that use it as their secret sauce to be able to prove out, how much ROI a practice or a physician is going to get from using their products and services. And then we have national sales teams that have it as part of their pitch process where they'll go through and and embed it within their proposals and calculate ROI and just use it
Wow.
to,
So wait a minute. So
yeah.
a sales rep now can find you guys, go to Hex IQ and say, I call on vascular surgeons
Mhm.
and I can help my vascular surgeon customers with their ROI for their own businesses or
So, I mean, they could do that, but the really exciting part is if you sell something into those vascular surgeons that's a product that they would use in their procedures or something that they would offer as a new service to their patient population, then you can prove out how much revenue will flow through from insurance companies based on whatever volume they have. So you can say for every 1,000 procedures that you do with this device or this process or this product that I have, here's the revenue that you'll get from Anthem, United, Cigna, Aetna in whatever region they're in.
got it. Now, for me, the sales rep that wants to utilize this service, is it you give me data too on you should be over here for
Yes,
your product?
definitely. So you can pull rates for your territory and then see, okay, who's negotiated a solid rate for the services that we care about. And then you can use that data to prove out ROI that way, or also to calculate what the downstream impact will be. So if you're selling into like a big hospital system, for example, you could say our products and services will bring in this line of revenue. And then, if it's a diagnostics tool or something, you could anticipate downstream that it's also going to lead to this. And so the ROI can be really compelling from small practices, individual physicians, all the way up to big health systems and national private equity owned organizations.
Wow. Okay. And it's all insurance based. It's all
Yes.
based on utilization through insurance.
Yes. So,
That's the only data. That's the only way the data is qualified.
yeah. So there was a transparency and coverage rule that just recently went into enforcement. And every month it requires that every commercial payer publish every single rate that they have negotiated with every physician, every NPI for every single service code. So no matter what your area of specialty is, you can go in and you can view this data. And obviously, insurance companies were not thrilled to have to publish this. It's part of a larger transparency effort in all of healthcare. And yeah, it's been, like I said, game changing for a lot of our customers. So we also work with physicians who use it to negotiate better rates. But on the sales side, it's great to be able to qualify everybody that's in your pipeline, to be able to say, like, all right, here are the people that are really going to benefit from the
Wow.
products and services that
Wow.
I have. And then I don't have to wait for a practice manager to give me all the reimbursement
Yeah.
information.
Yeah. Yeah.
Just come in and it's like you have a crystal ball and they're like, how do you know this? So,
Yeah. That law, you're right. That law passing is a huge deal. Okay. So give us an example, give us an example of the rep that's not utilizing this and then utilize this and life changed. What does it look like?
yeah. So if you're selling into a busy practice, you need volume data for how many of a given procedure this office does. And you need to know what their contracted rates are, what their payer mix is. And typically you're asking the practice manager or the CFO for this information in order to be able to sell into this organization. And the practice managers are super busy. They're tight for time. They may not know what all their contracted rates are. It might be in a filing cabinet. It might be a percentage of Medicare. And so it's kind of a make work project for that practice manager to get you the data that you need to build out your business case. But if you have access to this reimbursement information, you can just pull it for a specific physician within the practice itself, the parent organization, and then you can go in with a business case that already has real numbers in. And if you assume volumes, you can say, for every 1,000 procedures that you do, here's the revenue that you could be capturing if you use this product. So the difference is you can come in with your business case all buttoned up without needing to ask them for anything, any sort of information, versus having to wait and prolong the sales cycle and maybe find out that your prospect isn't qualified when you're already pretty far down the road. So it helps you to make sure that you're targeting the right prospects and to build a compelling case right from the beginning.
Wow. Okay. So Anne, indulge me. Give me your biggest success story with this to date. You don't have to leave it, you don't have to give names if you don't want to, but give your biggest success story where it's crystal clear how valuable this service actually is.
Yeah, so we're working with a diagnostics company who has a team of about 10 sales reps nationally. And they use this on a daily basis to go through and put together their pitches for large hospital systems. And they're able to prove out how much revenue that organization will be able to capture just from the diagnostic services that they have, but then also they can extrapolate all of the downstream revenue that that organization can capture. So it really makes it a no-brainer for the people that are in charge of revenue to actually move forward with their product. And so they've been able to reduce their sales cycles by up to 30%.
Wow.
And also clean out their pipeline so that they know that they're focusing on the next best practice that could benefit the most from the services that they offer. So it's something that they've operationalized and they use every day as they're figuring out their next targets and selling their products and services.
So I mean, it's kind of a loaded question, but I'm going to ask it anyway. So for that company, it's led to more revenue.
Yeah. And
Because
faster revenue.
Yeah.
Yeah.
More revenue because it's faster revenue.
Yeah.
Wow, that is amazing. Okay, so this is innovation, and did you know this law was coming?
Yeah, so we're kind of always on the lookout for fascinating data sets, and our background is in healthcare and manufacturing, and so we worked with a lot of medical device companies and pharma, and a lot of times people were relying on Medicare volumes, which trails by a couple of years, and we knew that this law was coming into effect, and we knew that the payers were not thrilled to have to disclose this because it's part of their business model to be able to negotiate rates and not have everybody know what they are. And when it dropped, we were blown away by the size of the data. So it's more than 2.5 times the size of the whole Netflix HD catalog that drops every single month. And then all of the files expire at the end of the month. So it's kind of a mad dash to get all the data and put it into a format that people can actually use it in. So when this law went into effect, it only required the payers to publish this in a machine readable format. And so it was really difficult for a business user to go in and be able to access the information that they needed. There's so much of it. So
Now,
we tackled that. We have a geospatial data platform that enables us to map all of the NPIs across the United States and then see what rates they have for all of these services across all the payers.
wow, when was this law passed?
It was passed in 2020, and then it didn't go into enforcement until July of 2022.
And enforcement means,
that payers were required to publish this every single month.
What's the adoption? Is it 100% adoption now?
Yeah.
Or wow.
Yeah. The payers have been great about publishing everything. It was definitely under duress. I mean, you can imagine that it's a big technical effort to compile all this information, and then you don't want to publish it so that all your competitors can see everything you've negotiated. But they have been good compliance-wise on the whole.
Okay, so I'm listening to this. I'm a rep, and I'm listening to this podcast episode, and I'm thinking, wait a minute, what did she just say? This is fascinating. Which type of rep, 30,000 foot view now, is going to absolutely 200% benefit from this. And as soon as they hear this episode, they need to get in contact with you.
Yeah. So if any reps know the reimbursement code that they care about for the product or service that they're offering, so if there's a medical device with a specific reimbursement rate or diagnostics code, if you know what your code is, then you absolutely need this product because it can help you prove out your ROI and make your value prop a no-brainer for any prospect that's qualified. So anybody who knows the reimbursement rates can benefit from this.
That's exciting. Now, have you noticed so far, do any specialties do better with this than others?
So there's been a lot of adoption in obstetrics and gynecology, in ortho, a lot in dermatology as well. So it has applications across many specialties, but those are the ones where we've seen the best traction so far.
When you say dermatology, you're talking like aesthetics.
Yeah, aesthetics and
That is
yeah.
that is so cool. Okay. How'd you get into this? Take us back. Did you graduate college and say, I'm going to start Hex IQ? Was it like a
No.
project or what?
So my background's actually in marketing, and I spent the early part of my career working in enterprise software. And I've been a serial entrepreneur for the last 15 years or so. And I worked with a lot of pharma, medical device manufacturing companies, and really became interested in healthcare. My mom was a nurse for 40 years, and so I kind of had a window into the healthcare world and was interested in it from there, and then learned about various aspects of healthcare from the projects that I worked on early in my career. And then when this data set dropped, it just everything came together, and we were very excited to solve this problem and figure out how to crack the code and get this into as many hands as possible.
So when did Hex IQ start?
So we started in 2020.
Okay, and was this, you woke up one morning after the data set dropped and said, we need a company, or was this already kind of in the works and the data set dropping just kind of facilitated everything? Like how did it happen?
Yeah, so there's a little bit of serendipity in there. So we were focused on healthcare data for what was available at the time, and then we caught wind of this legislation going into effect, followed it, and then as soon as it dropped, that was like July 4th weekend, 2022. We're like, I know what I'm doing this weekend.
That is
And my
amazing.
first thought was like, all right, I want to open it up in Excel. Like I want to
Yeah,
see
yeah.
all this data, and there's no way to open it in Excel without a data science team. So we anticipated it being, a 3-month project maybe to get it up and running. And it took us a couple of years to really
Yeah,
operationalize it and make it available for everybody
yeah.
in an easy to use format.
That is beautiful. Okay, so are there a lot of competitors in this space? Are you one of one? Are you one of 100? What does it look like?
There are probably about maybe 10 companies that are in this space. A lot of folks are focused on the hospital transparency laws in where practitioners and hospital systems have to publish all of the prices that they charge to patients um, for given services that they have within their hospital system.
Sure.
And then a lot of folks that are looking at the transparency and coverage rule are focused on the self-funded employer market. So companies that offer their own insurance plans for their employees. And so I believe we are the only company that focuses on sales and physicians as our target market. And so we make it easy for business users to figure out what the reimbursement landscape looks like, who should be targeted, who can benefit the most from various products and services, and then make it available for physicians to be able to negotiate more fair rates and for salespeople to be able to figure out who is the best target for their services.
So if you were to just guess and say that the medical device industry is 100%, what percentage do you think is aware of what you guys do?
I would say that awareness is fairly low right now. So a lot of times when the law first passed, we would go on calls with people and they'd be like, is this legal? Because I'm not really supposed to know what the negotiated rates are. So especially people in revenue cycle management were like, I've got non-disclosure agreements and I'm not supposed to talk about reimbursements. And the spirit of this law is to make it transparent and to make room for disruption. And so there has been a little bit of an education process for the market. So I'd say that maybe 20% are aware that it's there. And so we're excited to get the word out and get more people using it.
Now let's take it to the other side, the healthcare physicians. Same thing. If all physicians that could benefit from this, which was pretty much private practice in hospitals, right?
Mm-hmm.
What if they were 100%? What percentage is aware that this is available?
I would say maybe 25 to 30%. So again, awareness is pretty low.
So, and when they find out about this, they go nuts.
Yeah. I've heard game changing. This is unbelievable. I can't believe this data is available. I can't believe I can use this information in my renegotiation process on the physician side. And, altruistically, it's also going to impact the healthcare industry as a whole and to flatten rates and make things more affordable for everybody from a patient perspective too. So
Right.
I think the transparency era that we're in right now is really exciting for healthcare, for startups, for medical sales reps, for physicians that want to stay independent. So there are just so many applications, and I'm
That
so
is
excited to
amazing.
talk about it.
So then, you guys are what? I mean, you guys have been around for 4 years now, so you probably tripled, quadrupled in growth since year one.
Oh yeah, we're just really recently in our go-to-market phase because it took us years to actually crack the nut and be able to do this in a way that we could get it out into the world without it requiring a research project and, a team of 20 people to work
Wow.
on it. So we have a software as a service interface where you can just log in, download the data that you need, and we worked really hard to make it easy for folks to be able to access this information and to process all of the latest data every single month. We're also adding in some additional data sources around quality metrics so that you get more context around the providers that you're looking for. But the beauty of it is that not only do you see the rates, but you also see the relationships and how the money flows within the system. So you can look at an individual provider within a practice and then see how they roll up into the practice itself and then the parent company that owns it. And so, if you're a rep and you have the headquarters of a large national organization within your territory, then this gives you insight into how many providers are within that network and what the market opportunity could be in a way where you didn't have access to all of those connected networks before.
So you said that this reimbursement codes, diagnostic codes. So we're not talking, are we only talking about devices then and certain procedures, or are we including drugs in this conversation as well?
So drugs are not included in the requirement right now. So it was part of the initial transparency in coverage rule that went into enforcement, but then requiring drug codes to be included was deferred. And so it's coming probably within the next couple of years. That will be a requirement, and that will greatly inflate the size of the data, but also the value of the data on the pharma side as well.
Wow. 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 How soon is that coming?
There's no set date, so it was just deferred, and we don't have a date yet.
Sure. So on that note, reps now, at least with large companies, they get insurance breakdowns from their company about where they should spend their time. Is the service you guys provide, much more detailed or just different in a better way?
It's different in a better way because let me give you an example. So if you are looking to provide like lab services in a practice that doesn't presently have any lab services, and you're trying to prove out the value of keeping those services in-house instead of sending it to an external lab, you're not going to have any volume information, any claims data information from there. But with this transparency and coverage negotiated rate data, you can see what the rates are and prove out the ROI for what they will get if they bring that service in-house instead of sending it out. And so even if they're not offering the service that you're providing right now, you still have the ability to go through and prove out what those numbers will be. So if they have the patient population to support it, then you can build that business case in a way that was not possible before this data dropped.
I hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. I imagine this type of service would work well with marketing efforts from an individual provider or maybe a smaller company and industry that's trying to figure out how to get in front of their customer.
Yes, definitely. So you can use it to target, geo-target different areas, different physician groups, and have an idea of, what sort of ads you should run in those areas. You can look at any sort of geospatial characteristics of the neighborhoods and tailor the ads based on that. So there are a lot of different ways to use the data.
That is amazing. So on that note, then, with all the different ways to use the data, do you find your team is partnering with other organizations, or is it pretty much the I guess, for lack of a better word, the pot to focus on is so big that you have to put all your energy there? How does it work?
So we are partnering with lots of organizations on the physician side. So there are member associations that are offering up this data as a member benefit to their communities. And so that's one channel that we're using to get the word out. And then a lot of it is also seeing what other data sets we can fold in that will be valuable to go along with the NPI database that's enriched with all of this reimbursement information.
I imagine the partnerships will help with the awareness. So even though all these other companies that you're working with are making it known that this exists, you would still say the adoption on the physician side is still 20-25%.
Yep, it's still pretty low.
Wow. So I would like to imagine within the next 5 years, I mean, sky's the limit for you guys.
Oh yeah, there's so much opportunity in the healthcare industry as a whole for using this data for disruption, for new products and services that are coming out. And the sales reps that are using it in their sales cycles feel like they have a crystal ball when they're walking in, and so it gives them a lot of credibility in the beginning conversations to know what somebody's reimbursement rate is.
Yeah.
The data tells a really interesting story.
So and you have a team of 18.
Yes, so we're
And you're
17.
you're the head honcho.
I am, yeah.
So take us there. Take us to the night when you saw that this is becoming what you've always dreamed of. I mean, talk to us. What was that like?
Yeah, so our company has worked together in other capacities before we started Hex IQ. So our team's been together for a long time. We've got a great group of people, and we're all pretty nerdy, and we're all like a family. So we're all super excited that we had a new puzzle to solve and all of the different applications, and it's a lot of computer science that comes to bear, a lot of math, and so it's a lot of fun to go through and tackle all these problems. So everybody's been really excited to work on this project, and we're loving life.
As a serial entrepreneur, I imagine you work on this and you have this dream, and then it goes well enough, and then you work on something else, and then every now and again you get to that one that just hits, and it looks like that's what you guys have gotten to.
Yeah, it feels good. Yeah, it feels good to find something that has a mass application where lots of people can use it and benefit from it, and it actually can make a difference in an industry that has traditionally been not transparent, and this levels the playing field for individual reps, teams of medical sales folks, and independent physicians, and so it gives everybody a leg up in the conversation. So it's exciting.
That is awesome, man. So Anne, as a data person, how do you conduct every other part of your life? Is Hex IQ pretty much a 24-hour gig, or is it 10 hours of Hex IQ, and then you have a family, and then you research other things that kind of drive your data searching ways? Talk to us about what happens to make this all work.
So yeah, there's a lot of time management. I have 3 kids. I have a hobby farm. I do stand-up comedy for fun.
What?
Yeah.
Okay,
So,
wait. Do we have YouTube? Do we have YouTube?
I don't know. It's not all safe. I don't know that we can promote that.
Everybody listening, if she has a YouTube, that link will be in the show notes. All right, go ahead.
Yeah, you can find me on TikTok. But so I do have a lot of interest. Work-wise, this is my passion. I'm super excited about data. But
yeah.
I've got 3 kids and homing pigeons, and yeah.
So how old are the kids?
They are 12, 10, and 9.
Oh man, you're like in the thick of it. Like
Yep.
Thick of it. Okay. And girls, all guys, mixed.
Two girls and a boy. Oh, yeah.
Who's the boss?
Who's the boss? I don't know. Of the kids or
Yeah,
of our
of the kids.
house? Of
I
the
hope you
kids.
guys are the boss.
No,
Of the kids,
it's
who's the
kind of
boss?
egalitarian. I think everybody has their strength, and yeah, we're definitely democratic.
And you guys are true analytics. Okay.
Yeah.
Okay, that's fascinating. And then the hobby. What's the hobby?
So I have a hobby farm. I do stand-up comedy, storytelling.
I don't even know what that is. What's a hobby farm?
It's not a farm to make money, just a. So I've got chickens and
Oh,
about
you
10
have like an
homing
actual,
pigeons.
like you got a ranch.
Well, yeah, ranch might be a stretch, but I have 10 homing pigeons that hang out,
Wow.
some chickens, a
So
few dogs.
you guys have natural organic breakfast.
Oh yeah, yep.
That is amazing. That is amazing. And I'm assuming the whole family's involved. It has to be a family effort.
Yeah, definitely. So yeah, we live in rural Maine, always about an hour away from wherever you want to be. So we're
Right.
in
So
a
you had to make
beautiful
it
little
work.
space out here. So yeah.
That is fascinating. And then the stand-up comedy, we have to spend some time there. So is the topic data or is it something else completely?
No, there's no data topics. It's more family and relationships and yeah, storytelling. So
Storytelling. Okay. And like you actually, I mean, you regularly go to venues or it's just like a one thing you've done, off thing you've done here and there, or how does it work?
so I have shows every once in a while in Portland, Maine. So I have a storytelling event coming up in September. I do open mics on occasion. I do stand up at clubs and breweries and
Wow. I think that's one of the coolest things I've heard a guest say. Your juxtaposition of a data scientist and a stand-up comic. I mean, it does not get better than that. That is
I used to be a
awesome.
skydiver. I feel like I used to be cooler than I am right now, and I was hobby hunting for a while when I stopped jumping, and comedy filled the void. But
So you were a skydiver too.
yes,
What
yeah.
stopped that?
Kids. I wanted to have kids, and then risk reward ended up not being worth it. But when I was in my early 20s, I needed it for just focusing and staying in the moment, and
Yeah, yeah.
it's a lot of fun.
I've gone skydiving a few times and I absolutely love it. I was the guy that's like, I cannot wait to jump out of that plane.
Yeah.
I assume though that it's a relatively safe engagement, but I mean, for you to stop due to that, it's not as safe as that then.
Well, I mean, it's safe. It's just, I guess, there are risks involved with it. And then if you're not doing it all the time, then you can get out of practice and, you open yourself up for more injury and, just if you're doing it every single weekend and having a blast and that's a focus, then I feel like that's safer than just fair weather jumping coming in every once
Yeah.
in a while. So,
Yeah, that's fair. So, data scientist, you got this team you've been with for 10 years now. You guys found the big one and you're going nuts. Where did the stand-up comedy show up? Why and how and what allowed it to continue? I mean, I'm curious.
yeah, just I need something outside of work to be a draw. I tried, crafting. I
Yeah,
tried lots of hard hobby farming stuff, and
sure.
nothing really lit me up the way that skydiving used to. And then I had a friend who was offering a comedy workshop, and I was like, I'm funny. I could do that. And so I did
Wow.
that, and yeah, from that moment, I've been interested in performing. It's just scary enough, so it's not quite as intense as jumping out of a plane, but when you pick up that microphone, it's a lot
Yeah,
of fun. Yeah.
yeah, that's I went when I first moved to downtown LA. This was, gosh, maybe 11 years ago now. I went to improv, to
Yeah.
Groundlings in Los Angeles to do an improv class, just to kind of be, an extra skill set to kind of develop. And I actually passed. I passed the first, that big Groundlings test, whatever. I passed the
Yeah.
first one. Yeah,
That's
I got.
awesome.
I did not continue, but I mean,
Yeah.
it was fun to do all that improv and just come up with something on the fly. And I know that stand-up comedy is not the same because it's more practiced. But I remember meeting some stand-up comics in that time and thinking, huh, I wonder what that life is like. That is so cool. Okay, so data scientist, family woman, hobby farmer, and stand-up comic. Talk to us about what's going on with social media and data. I think I'd like to believe that with AI, with how easy it is now to go from complete obscurity to somewhat of a brand through social media, and now with access to data that was just never accessible before, where do you see us 10 years out? Are we going to be playing a completely different game than what we see now with healthcare and how services are utilized and products are used? Or do you see, much more of the same?
Oh, I definitely think in 10 years, there's going to be a lot of differences. AI is going to play a huge role on the business side of healthcare and then also on the practice side as well and at the bedside. So I don't even know if it's possible to predict how the world is going to look, but I feel like the transparency that is going on in the US healthcare market is really healthy, and people being able to look at what the problems are and find novel ways to solve them is going to be game changing. And just the speed with which we can deliver things in healthcare is going to improve a lot. So traditionally, putting in new technology in healthcare has actually slowed things down. So you think about electronic medical records and trying to
Right.
connect everything. And I feel
Right.
like AI is going to help bridge that and get healthcare onto more of the leading edge of the industry. So it's really exciting to think about what the future holds and what the possibilities.
Yeah. Now, while this is all going on, there's another thing going on, and that's the vulnerability that we all have because we're doing so much online, and so many of our businesses are contingent upon online access. When you think of your company, Hex AI, Hex IQ, and what you guys are doing, you know, is it? Do you think about that? Is that just if that happens, oh well, or is that or are there things you guys have thought through to work around it if that was something, if something was to affect the connectivity that we experience today?
Can you ask that a different way? Sorry.
Sure. Okay, so you know, for example, we just had this recent cyber strike thing that happened, right? Now taking any entity and affecting their online connectivity on a mass scale can happen, right? Whether it's by accident or by terrorist group or whatever. And I wonder if companies that solely work online, like ours, for example, and yours, are you is there anything to be done to be able to continue business if something was to affect online connectivity? Or is it you kind of look at it like, well, if that happens, so much of the world's gonna be disarray anyway. It's not really gonna matter for us.
Yeah, so we do have a mix um, of data processing that happens in the cloud and that happens within a data center as well. So if we were to lose connectivity, we would still be able to maintain the data that we have in our data center ops. So it's something that is definitely a risk because the way that we access the data from the payers is online, the way that we distribute
Right.
it to our customers is online, but we
Right.
do have disaster recovery and backups in place to be able to maintain continuity, in the case of disruptions to service.
Now, hacking is something that everyone has to think about today. Email, I mean, anything online. Is it apply here as well, or does that not really, getting access to records and fraud and things like that? It doesn't really exist in this data research space, or is it just as risky as anything else?
In this space, it's not so bad because there's no HIPAA data that we have to worry about at all. So it's all just the business side of healthcare.
Sure.
It's not specific patient records or information or volume data around that. It's all the pennies and the pins and the paper clips as far as what the flow of money looks like, but not what patient care is.
Got it. Got it. Okay. A few more questions before we bring this to a close. What are the reasons to not use this service, if any? Are there situations where this would not be advantageous, or if you're in this situation, don't bother?
So if you have a product or service that's not specifically tied to reimbursement revenue for practice, then this service wouldn't be as beneficial for proving out ROI. It may help you find various practices that meet the profile that you're looking for as far as number of physicians or specialists within the group. But where it really shines is when you have a reimbursement code that you know and love and care about and can articulate to your prospects. So if your product and service is tied to reimbursement in the medical space, then that's when it makes the most sense.
Fantastic. This was awesome, man. I mean, what you guys are working on is truly exciting. I love everything you're doing. How can people find you?
So we have a special page for listeners. If you go to hexiq.com/podcast, then you'll see a special offer there for listeners here where you can get a detailed prospect report for a sales cycle that you're in. So if you provide information on a hospital system or group or individual provider that you're looking for, then we can help you sleuth out what their reimbursement rates are for the codes that you care about. So if you go to hexiq.com/podcast, then there's a free gift in there for listeners.
Wow. And everyone, that will also be in the show notes. Okay. And we have one more thing to do.
Right.
Are you ready?
I think so.
You think so? Okay.
Yeah.
We have the lightning round.
Uh-oh.
In the lightning round, I'm going to ask you 4 questions. You have less than 10 seconds to answer.
Oh, no.
All right. First question. What is the best book you've read in the last 6 months?
Ooh, in the last 6 months, less than 10 seconds. I really like Blink by Malcolm Gladwell.
Oh, that's a good one. Yes, classic. What's the best TV show or movie you've seen in the last 6 months?
I really enjoyed The Old Man, which is
The Old Man?
Yeah,
What is
it was
that?
a series. So The Old Man with Jeff Bridges, and he plays an aging CIA operative, and it's just really entertaining to watch.
Very cool. How many seasons?
I think it's just one right
Just
now.
one. Okay, very cool. Okay. We want the restaurant location and item. What is the best meal you've had in the last 6 months?
Ooh, so there's a place called Scales in Portland, Maine that is just phenomenal for seafood. And I had halibut there 2 weeks ago, and it was just to die for. So highly recommended. If you're in Portland, Maine, go to Scales.
That is happening. And last but not least, what is the best experience you've had in the last 6 months?
The best experience that I've had in the last 6 months. 10 seconds is so hard to.
We won't hold it against you if you break time. Please still answer the question.
So I would say the best experience in the last 6 months is taking some time out with the kids and spending a weekend on the lake swimming and just relaxing and enjoying the beautiful weather in Maine was the highlight of my last 6 months.
That's awesome. And it's a true treat to get time with you today. This stuff you're working on, it's clearly the future. You guys are in the infancy stages, so the future is extremely bright. Thank you for sharing it with us today, and we can't wait to see what you guys go on to do.
Thank you so much. It was awesome talking to you.
Absolutely. And that was Anne Saulnier. Wow. It's unprecedented times to have access to that kind of information at the level they now have it, and make it a resource for really anyone to use. It's just a different time. This is the time where you can be just someone in complete obscurity and become a household brand through social media. This is also the time where you can have access to a customer's data on how they're reimbursing their services and products, bring it to them in a pitch, and have them do business with you because you have access to that kind of data. These are the times we live in. It's amazing times, and it happens in this wonderful field of medical sales. If you're someone trying to get a position in medical sales, you already know what I'm going to say. Visit evolveyoursuccess.com, get some time with one of our enrollment specialists, and let's get you into a position of your dreams. If you're looking to improve your sales performance, you want to make some things happen, you want to utilize resources like this. Again, go to evolveyoursuccess.com, get in touch with one of our enrollment specialists, and let's get you where you need to go. As always, we're doing our best to bring you guests who are doing things differently in the medical sales space. So I really do hope you enjoy this episode, and make sure you tune in next week for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional, or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.